A 63 years old male present with severe episodes of the hematuria. He suffers from COPD secondary to smoking. That means a smoker patient present with hematuria. What is the underlying cause? So it is almost a direct question that a patient regularly a smoker and develop hematuria. What is the cause? Here the options are renal cortical adenoma, renal adenocarcinoma, nephroblastoma, transitional cell carcinoma of the bladder, adenocarcinoma of the bladder. Let's see the bladder cancer. The bladder cancer is the second most urological cancer. So the blood cancer, it is the second most urological cancer. So it is one of the most common cancer in urogenital system, and it most commonly affect the male and age between the 50 to 80 years of the age. That means the older age. Smokers have 2 to 5 fold increase of the disease. So who smokes, there is chance of development of the bladder cancer 2 to 5 time increase. And exposures to hydrocarbons such as the 2-naphthalamine also increases the risk. So the naphthalamine, it also increases the risk of the bladder cancer. Chronic bladder inflammation arising from the schistosomiasis. The schistosomiasis, which is helminth, and when the or parasite, so schistosomiasis, it causes a squamous cell carcinoma. Actually, keep in mind that when there is chronic inflammation or chronic friction, when there is chronic inflammation, when there is chronic infection, there is chance of development of the squamous cell carcinoma. So in case of the bladder catheter also, when it keeping the longer time, years, in this condition, there are also development of the squamous cell carcinoma, because there is a longer time irritation by the catheter. And here we can see the bladder cancer, benign and malignant. In case of benign tumor are inverted urothelial papilloma and adenoma, that means OMA. So papilloma and adenoma, they are the benign tumor of the bladder. On the other hand, the malignancy are transitional cell carcinoma, squamous cell carcinoma, and adenocarcinoma. And most common is the transitional cell carcinoma, because we know that the lining of the bladder is the transitional cell. So there is development of the transitional cell carcinoma. It is 90%. Second one is very few, which is 2% by the adenocarcinoma, and the squamous cell carcinoma also very less, and it all occurs due to the schistosomiasis. So transitional cell carcinoma, it is the most common subtype among them, and it is strongly related to the smoking. So there is the heavy smoking, there is chance of transitional cell carcinoma. And adenocarcinoma may produce similar symptom, but it is least common, very less. So a smoker and episodes of hematuria, what we think? First of all, we have to think the transitional cell carcinoma of the bladder. Adenocarcinoma, it is very less. Nephroblastoma, actually they are the tumor of the kidney. Renal adenocarcinoma, renal cortical adenoma, they are actually the tumor of the kidney. So our answer is the transitional cell carcinoma.